All right, in case you're wondering, for the record, I'm going to be 40 on Friday. And so for the next 2 days, I can and will continue to say I'm the only member of the governor's cabinet who's under 40. I do want to recognize some of my colleagues, though, from the cabinet who are here. Director of ODATAS, Orman Hall, is standing toward the back there. And then Director John McCarthy of Medicaid is here, and Director Ted Wimslow of Health. And those are the three folks I've seen. So if there are others, I apologize if I don't see you. In thinking about what to talk about today, we live in a world that's unpredictable. Things happen all the time that we are not anticipating. Traumatic events within our society, diagnoses within our families, maybe cancer, mental illness. We suddenly discover that someone we love is struggling with an addiction of which we had not been aware. And it's very easy in these times to withdraw, to be embarrassed about things, and to, really kind of further the stigma that challenges a lot of these circumstances. And it's not good for those who are immediately impacted by these challenging circumstances, like trying to support someone in your family or yourself with mental illness. And it's not good for others in our community who might actually silently be struggling with similar circumstances. It's not helping to empower others. And so I think that events like this that really shine a light on the fact that we can do something about this, and we should be reaching out to assist ourselves, to assist others. It's just extremely important. And it also helps in that it's liberating, and it helps people maybe connect with access to the extent that access to services is available. And many of you in the last months have heard me talk about access to services and how Medicaid expansion will really be helpful in this regard, specifically for people who are living with mental illness and addiction. If you are a childless adult today and you have income of less than about $16,000 a year, you do not have access to Medicaid services in Ohio. And if you're working, you might be working part-time job or working a very low-income sort of a job, healthcare is probably not affordable, or it might not even be available. And I think that our governor, who will be introduced here in just a moment, has seen this as a challenge that we need to overcome. There are folks who are struggling to support their families. There are employers who, want to have a healthy workforce, and this is an opportunity for us to do something to help the progress of Ohio as a whole. And so I appreciate the advocacy that many of you have demonstrated over the months recently, and this is a long road, and we are absolutely committed to taking steps to help connect people with the health care, and particularly the mental health and the addiction services that are necessary. There's a lot of representation from the local boards here today, and the ability of Medicaid to come in as a payer for some of these clinical services will help the boards direct existing dollars into other areas that are critically necessary, like housing, like employment supports, prevention services, and partnerships with schools and with other community coalitions. And these are all opportunities that we have, and this is sort of a once-in-a-lifetime opportunity to make this happen. I was up in Youngstown last night. The Family Recovery Center is as old as I am and is celebrating its 40th birthday. And Christopher Kennedy Lawford was the keynote speaker. And he's a son of Peter Lawford, who was a member of the Rat Pack and from the Kennedy family. And he talked about the circumstances of addiction and how that was, sort of an open secret, to the public, that this family specifically has struggled despite all of the wealth and power and everything that has available to them. And he said that he has been living in recovery for 27 years, and he has 3 children. I think they're all young adults or early adulthood now. And he said, my children have only known me in recovery, but I've been very open about the circumstances that I've struggled with in my past, because I want them to feel open and feel comfortable if they ever experience a problem to talk about it. And I want them to have that same sense of openness with other people that they care about. And so I think, this is a message that we all need to take back to all of our corners of Ohio, that there is not shame, there should not be stigma. This is our community, and this is our responsibility to try to support ourselves, our families, and our overall community. So I just thank you for being here, and keep up the good work. I'm going to turn things back to Terry to introduce the governor.